93,000 people rather, have died of drug overdoses in the last year. And here in Arizona, according to the Centers for Disease Control, drug overdose-related deaths rose by 33% from 2019 to 2020. Team 12's Josh Sanders spoke with an expert on why we're seeing that sharp increase and a local family who lost their teenage son to a fentanyl overdose last May.
Everything we see or do or talk about now goes through this new filter of law.
Trying to make sense of everything since then has been the biggest thing the last couple months.
Matt and Lindsay Taylor know the pain of losing a child to a drug overdose. On May 9th, their 17-year-old son Alex, a senior at Hamilton High School in Chandler and once competitive gymnast, overdosed on fentanyl.
This is a true crisis.
I'm just shocked at how many people are affected by this.
According to the Centers for Disease Control, drug-related overdose deaths rose 29% across the country in 2020. In Arizona, 33%.
I think the research will probably show that people that were already using drugs, their drug use just got exacerbated because of COVID.
Nick Savros is CEO for Community Medical Services, clinics providing treatment for drug addiction with 21 sites in Arizona, currently serving 7,000 patients. He says while the increase isn't necessarily pandemic-driven, there are several possible factors for the spike, including access to drugs like synthetic opioids.
Cheaper, it's easier to manufacture, it's easier to smuggle.
Stavros says ending the stigma surrounding addiction will help.
But society needs to look at addiction from a place of compassion. That's what's going to lead to more people wanting treatment, more people coming to terms with the fact that they need treatment, and more people entering treatment.
And for Matt and Lindsay, part of ending that stigma, telling other families they are not alone.
We want to save other families who are going through something like this.
Josh Sanders, 12 News.